Welcome back to another episode of the Resting Stitch Face podcast. I'm your host, Dr. Erin Sheffield with
Dr. Sarah Harding. Today's episode is all about the unspoken rules. What specialists wish referring doctors knew, but don't always say out loud.
So, what do you think, Sarah? Are there things that you just wish dentists knew, especially those things that happen over and over and over again? I will start. One of them is I don't need vertical bite wings. I'm not going to do anything with vertical bite wings. Like, I need to see the apex of the root. I need to see the anatomy of the jaws. I need to see what the tooth looks like in all of its glory. And so those vertical bite wings are doing me nothing.
True. Yes, and they always send them. And I feel like, Erin, I understand why they send them. And they send them because they've taken these images and the patient paid for them or their insurance paid for them. And so they're like, this is all of the information that we have. And I'm going to send you all the information, which I totally appreciate. Because most of the time I feel like, or not most of the time, a lot of the times I feel like I'm not getting any information, and so I'm like, okay, that's information. But the problem that I see with that is that the patient's like, well, I brought x-rays, or my dentist sent x-rays. And so then it's this whole 10-minute discussion where you're trying to bargain with them about, well, those aren't really the x-rays that we need. I can't really see what I need to see. And, even if they sent a PA of that one tooth, I still like to have at least a pano because I just want to know I'm not treating a tooth. I'm treating a patient. And so I just need all the information so that I can feel like I'm actually treating you appropriately. What do you
Yeah,
think about that?
amen. That's a good point you make. I mean, at least when they send what they have, then I know, okay, this is enough. I need to get my own because otherwise then it's like, I know I took one. We just did it. I just paid for it. And then we're on the phone for a million years with the referring doctor's office. Oh, do you have something? Did you send the wrong thing? Do you have anything more? The patient thinks that they did. Can you send it over? And for some reason in my office, email is like waiting for the Pony Express to arrive. Like everywhere else, it seems to be instantaneous and digital, but in my office, it will take like 20 minutes for some reason to
It's not
receive
just
an
you. It's not
email.
just you. Yeah. Yeah, it's not just you. And it's not
But
just that. It's like having to be on the phone and then you're waiting on the phone and then they're trying to find the things. Then
yeah,
they want to ask the doc because there's always a question about what's actually written on the referral and is
yeah.
this the most updated information and da 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 da. Yes. Yeah, I agree with that. I think that's frustrating because the patients don't really necessarily know.
We always have to get one anyway. Yeah, I agree. So yeah, at least they sent what they had. I also think when they send the full mouth series, you're like, I'm taking out tooth 24, and they send the full mouth series. And if it were all in one layout, that's great. But it's full
Individual
8 by
files.
10 of each. And they're upside
Yes.
down and and you're like, which, I mean, it's really good for dental anatomy. I'm like, okay, which tooth is this? And my assistants always have like the mandibular ones and the maxillary spot and stuff. And so, I don't know, it's kind of funny. It's one of those simple things, but
Yeah.
yeah, it's almost a daily aggravation. But I think your point about the communication is so important because the other thing is you get referral and you're lucky if it's got the X on the tooth and even a
Mm-hmm.
signature. Or the
Mm-hmm.
signature, and you're like, I don't even know who this is from. What does that say? And then patients will come and they'll be like, yeah, I'm just not sure if I should have this tooth out or not. And you're looking at and like, I can't see anything on the x-ray. And I don't
Mm-hmm.
know based off of the
Actual
22nd chief
referral.
complaint what's wrong with the tooth.
Yeah. And
And they're
there's
like,
nothing on the referral that says internal resorption or
right, or a
anything.
crack or anything.
Right.
And so you're going,
Yeah,
ah,
you're asking if they did, vitality testing, and you're trying not to make it sound like you're an idiot.
right. Like, I'm looking at a macro level. I'm not taking my Explorer or my probe hardly ever. I want the diagnosis. So it'd be so helpful if it's not obvious. Like, if it's root tips,
Mhm.
like, we know.
Got it.
But it would be so nice if they would say due to a crack or irreversible pulpitis, they refuse root canal, things like that. And then I can support you as a referring
Yeah.
doctor. Because usually my blurb ends up being like, oh, well, I really trust your dentist and I really rely on them to let me know what needs to be done. But
Mhm.
it'd be so much easier to like, oh my gosh, your dentist is so fabulous.
Yeah.
they diagnose this crack, which is so hard to do.
Right.
And so we're just so
Yeah.
glad they're able to figure it out so we can get this tooth out for you.
Right, because a lot of times they'll come in, and if it looks okay to me, it probably looks okay to them,
Of
and then
course.
they usually will be like, "But I don't really wanna get the tooth out," and so then I'm having to justify taking the tooth out, but I don't know why we're taking the tooth out, and that makes it really difficult too. So,
Oh, for sure. And then it's kind of scary from a liability standpoint of like,
mhm.
well, they said to take it out, so I am. But
Yes, and I've gotten
did they
burned on
pull
that too
test?
because they
Did
put
they?
the wrong tooth
I
number on
know.
the referral, and I'm like, "This seems to be okay," and I talk to the patient like, "This tooth seems to be okay. You've got these other issues that we've got going on, so we'll probably have to address those at another time, but the referral is for this," and so, like, get a mirror out, and I'm like, "Is this the one
Yeah,
that,
I
like,"
know.
and, like, trying to point to it, and they're like, "Yes," and I'm like, "Okay,"
And I'll be
just so that
like,
we're all
did
in agreement,
did they do pulp testing? Did they put cold on your tooth? No. And I'm like, was that like a fake thing we learned about in dental school? Is that a real thing that real practicing dentists do? Because it seems like no.
I think
Because
so,
it seems
right?
like I'm always the one that is like the first, like, we can't figure out which tooth it is. And I'm like, why am I the first one to like think, haha, I've
Mm,
got this diagnostic aid that we could do to
right.
try to decide.
Yeah.
No, I'm so genius. I'm the only one. And then I do, and it's hardly ever does it make any sense. And is that
Right.
why people aren't doing it?
I
I
don't
don't know.
know.
Do I not remember how to do this? Because it,
Yeah. And the hard part too is for the patient because the patient is already in a strange place for them. They don't come to see us all the time, right? Or hardly ever. And then they come and then we haven't had a conversation with their dentist. We just have this little slip of paper that they brought in with them because we didn't know any information. And so then they're here and they're sitting there and they're waiting. They probably have something else to do that day. And they're really pissed because they want to just have it taken care of, but now we require that they have a consult. And so they're just sitting there and then they're like, why are you guys so uninformed and why are you so unprepared and how can you not know what the problem is and don't you talk to my dentist and it's
oh,
all
they
of this and
start
I
getting
get
so
that
upset.
too.
Where's my
Yeah.
they're supposed to send the x-rays. They didn't send the x-rays. And I'll be like, no, I'm looking at it right here. And they're like, they said they were gonna send the x-rays and they start losing it. And you're like, no, I'm just asking a few questions. I've got the x-ray right here. But
Right.
then heaven forbid you don't have the x-ray. Or I had a
Yeah.
patient the other day. She was having all of her teeth out and we are gonna place a denture. And I told her, we really need to have the denture here. I've learned my lesson. If you want your
Mhm.
denture, it needs to be here because I'm not the one making it and I can't
Mhm.
magically poof a denture up because the teeth are out. So if you care
Yeah.
about having the teeth the same day, it has to be here. So make
Mm.
sure the dentist has it and it's made.
I usually won't let them schedule until they actually have it.
That's smart. So they're like, yeah, the denture is supposed to be here and they're supposed to drop it off. I'm like, well, we don't have it yet. Do you feel comfortable proceeding or should we wait till we have it in hand? It's supposed to be made. So it seems like it's okay to go ahead, but I can't guarantee what if it got lost in the mail or something. So then she's just like, oh my gosh. Oh, this is terrible. And her husband, you better tell my son what's going on. So bring the son back and well, we're just waiting because we want to verify we actually have the denture before we go ahead. And they're just both like, oh my gosh, this is the worst thing ever.
Right.
And finally, the denture arrives. Their assistant drove it across town to bring
Right.
it. Isn't that so sweet? Like they have the time for that. And we get going and we're like, do you love your dentist? We think he's so nice. We think he's so sweet. Is he as sweet as a dentist as he is as a person? And she's like, I thought so till now, until this
Oh gosh.
debacle, until this absolute nightmare type of thing. And I was like, what do you mean? This is not a nightmare. I
Yeah.
said, this was a minor blip in the road. This was a 20-minute
Mhm.
delay. We are all ready to go now. I got all of her teeth out in 8 minutes, so we were still on time. But,
Yeah.
when we communicate, it's so much easier to protect the referral because that's what we're doing, right? Like, I
Right.
think sometimes referrals think that we're trying to throw them under the bus. I am trying to
No, yeah.
hype you up as much as possible.
Yeah.
And it's so much easier for me to help support your treatment plan if I know
Mm.
what the treatment plan is and why.
Yeah, because patients have a lot of choices. General dentists, like, whoa, you know what I mean? And so the amount of choices that patients have is significant. So I always do that too. I'm always like, wow, they're just really great. Look at this detail. They're really great at communicating. And I just really enjoy working with them, and it's just
Right.
stuff like that. So I don't
Right.
know. I
And
try.
I do genuinely love when you, like, have that relationship and when they actually will call you with a question
Mhm.
or a concern and a follow-up. It's so much easier than just trying to figure out from a little trick chicken scratch on a
Yeah.
paper
Yeah.
that got coffee stains on it in the meantime.
Yeah. Here's one that I've got for you, Erin. I had this happen, it was a while ago, but there was a referring dentist at a practice that I used to work at that was very rigid, I guess. And this dentist would send patients over with a referral, and they would do a really good job of kind of prepping the patient for what they're going for. But it almost felt like to me that they were like, I will tell you what to do, and you're my monkey, and you will do it. And I'm like, "Eek." I get that, and, like, I would really love it if that's all that I did, because that's really easy, right? But just that attitude doesn't release me from liability, right?
Right.
And it doesn't release me from my deep desire to educate my patients and
Mm,
my deep desire to make sure that I'm looking at the whole big picture and making sure that I'm not just solving this one problem, but creating another one. And if I am doing that, I want the patients to know that that's the case and know what
right.
to look out for and know what other outcomes could happen, because I would just really love it if you could just tell me what to do and I would do it. But I don't feel like I went to, all of this extra training to do that, because I don't think that that's necessarily like a good collegial professional relationship or a good use of my education and skills,
Yeah.
right? What do you think about that? Have you ever
Oh,
had
I was
anything like that?
thinking something similar as far as when the dentist maybe kinda over prepares the patient. Like, for example, like, "Oh my gosh, this wisdom tooth is just wrapped around the nerve," which I also think is, like, funny. Is that really what we're saying? Because I hear that all the time from
Yeah.
patients. Why are we saying the root is wrapped around the nerve? Like, even if it were, I would say the nerve was running through the root. I wouldn't say the root was wrapped. Like, I don't know.
Yeah.
It's
I
just
guess
kind of
patients
funny
understand it better.
mentality.
Yeah.
But then they come in and they're, like, freaking out, like, "Oh my gosh, I don't know what to do because they said that
Mhm.
the root is wrapped around the nerve, and so I'm having this pain, but now what could we possibly do?" And I'm looking at it going, "I'm
Yeah.
not even worried about the nerve on this
Yeah.
one." And so
Well,
I'm
and I
trying to
think, Erin,
backpedal a little bit.
yeah, I think that when I hear those things, to me, I'm imagining that the dentist is saying, "I'm unable to take this tooth out," because you hear it all the time, like, "Oh, this tooth is in the sinus,"
Oh, yeah.
and stuff like that, and so I imagine that they're trying to justify why they cannot do it in their office, and that's why you're being referred, and so they have to make it sound a little bit, like, scary so that the patients will understand, because the patients just wanna stay in that office. They just want you're a dentist, right? You're a dentist,
Yeah.
you can take teeth out. Why can you not take my tooth out? And so I think about it from that perspective, and so I usually will say, "Oh, yes, it is really close to the nerve, but that's what we do all day, every day, and so that you're in
Right.
the right place, and I'm really glad they sent you, and we'll take good care of you, and, if there are complications, which there sometimes are, that are very capable and of treating that, and well, let's talk about it, you know?"
Mhm.
And so I think that's the way that it kinda
No,
goes.
I agree. I even wrote that down in my notes that I think they're trying to save face or trying to show legitimacy for the referral, but I also think sometimes they overshoot and then we're
Yeah.
kinda trying to regain that
Backpedal
trust or
there.
get them out
Yes.
of this worry bucket that they didn't need to fall so deeply
Yes.
into so I don't know. I don't know what the conversations are. I suspect sometimes maybe we could be a little more confident and like, "Hey, I just they do this all day, every day, and they're so good at it, and I just know you're gonna have a much more positive experience going there than with me doing it, instead of having to be
Mhm.
like, "Oh my gosh, this is the worst I've ever seen, and as
Yeah.
good as I am, I don't you better go there."
Yeah. But, this is not what we're taught. We're not taught about this stuff in dental school. So you imagine that people are kind of doing it on the fly and not really understanding what the continued conversation looks like once they arrive at our office, right?
For sure, for
Yeah.
sure.
Yeah. And so I
That's a
think
tough spot.
it is a tough spot. Yeah. And I'm
And we
happy
do
not to
get
be
the
in it.
patients all the time, they're like, "I don't know why my dentist wouldn't just do this."
Yes. Yes. They're like, wait, it's all, you're done? You're done? Why couldn't my dentist just do that? That was so quick and so easy. And I'm like, well, you know. Might just be that this is all I do, like, you don't want me trying to do your crown, right?
Yeah, that's the other thing is, "You did such a great job, why won't you make my denture?" And you're like, "Oh my gosh,
Oh, because you
that
actually
would be
care what
really
it
bad."
functions like and what you look like, probably, you know? Yeah, I would make it look really good, but it would take me a really long time to do it, and it would be such a
I
waste
am
of all of our
imagining
time.
this Sarah Harding denture would be
The festooning is my
the
favorite.
100-hour denture,
Yes,
probably.
it would be perfect. Just ask my husband who when I used to cut his hair, I actually just did this weekend, was cutting somebody's hair, but, um, I used to cut his hair, and it's, like, one little piece out of place, and I'm like, "Do, do, 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 do," you know? And, like, he's like, "Are we done yet?" And I'm like, "No, it's almost there." And, like, the shaping is so important, just like the
I mean, dentists
festooning.
and barbers have the same, origin
Yeah, the
story,
barber
so
surgeon, right?
yeah,
I know. I know.
little Sweeney Todd action there.
Yeah. So, let me see. I had another one for you. Oh, this was a big one. I haven't seen it in a while, but one that I had a lot in the Navy and in residency too, I think. We'd get patients that would come in and they'd be like on edge, just like, oh God, I'm terrified, I'm terrified. And they're sent in, and you're like, okay, how's everything going? And we'd taken a pano and they're like, my dentist said I might have cancer.
Oh,
You're
I
like, "Oh,
know.
dear." And you're like, "Okay, well, let's take a look. So what's going on?" You look at the X-ray and you already know what it is. And they're like, "Well, they said that there's something in my sinus that's growing and they think it might be cancer." And you're like, "Oh, dear." And so, let's look at it. And so we look at it together like, "Ah, yes, this is just a mucus retention cyst or mucus extravasation phenomenon, right?"
Right.
And you're like, "This is normal, it happens," and I see it a lot more in California than I did in other places that I've lived and all of this just stuff, and I was like, "I don't know if it's the dry air," and then I'd, like, describe the whole thing, and I'm like, "But you're perfectly fine, as long as it doesn't create any functional deficits or you're not feeling congested all of the time or you're unable to clear your sinuses, like, we'll just leave it alone and kinda monitor it and make sure everything's okay." They're like, "Thank you," and I'm like, "Thank you. I didn't even do anything, but apparently I saved your day."
Well, and that's kind of example of what I was talking about too, just like overstating things
Mhm.
or making a diagnosis that maybe you're not comfortable making. Like I think it's good to put ideas in minds or give an idea about maybe what it could be if you're not certain. Or if you're not certain, like these wisdom teeth, they look really tough and they might be close to the nerve, but I'm definitely gonna let the oral surgeon decide if they recommend they come out or not, or
Yeah.
this looks worrisome, might need a biopsy, might be something that's concerning, but I'd definitely want you to go see the specialist and see what they say. Might be a way to approach it instead of
Yeah.
the fear mongering, but I don't know. It's tough. We've all seen things that we're not familiar with that look scary, and then you find out it's okay, which is relief.
Yeah. Yeah, and I think that's one of the funniest parts about having been in the Navy too, was that because we were just a hallway away, right? And so you
Oh,
get
sure.
these young dentists that are right out of dental school, and they come over and they're like, "I've got this patient, and I need you to come see them right now." And they're like, terrified, and you like, go over and look, and it's like something, and you're like, "Okay, no big deal." And they're
I
like,
remember one of the
"Why don't you
GPRs.
think it's a big why do you just dismiss me like that? Like it's no big deal." And I'm like, "Well, it's because we see it
Right,
all the time. It's not a big deal." And like I always,
right.
you know, I don't know how
When
to
I
like
was
play into that, but not play
in
into it.
residency, a GPR called me over and they thought it was this huge tumor, and it was just the hugest chunk of calculus ever.
Gross.
But it looked like a horrible, bony, exposed tumor, hemorrhage or something. Or how
Right.
many times have you had a referral from a physician and then it's just a palatal torus? So,
Mhm.
yeah, definitely.
Yeah. It is funny though, and I think that I so often I try to put myself in somebody else's shoes because I think once you've done this for a long time, and you know this too, it's just that things don't really phase you quite as much because you know how to take care of it and how to treat it, and it's how to talk to the
Right,
patient, and it's okay, and even if it's
right,
bad, we still just move forward, right? Just stopping and
right.
freaking out isn't helping anything
Yeah,
get
exactly.
better. So
And I
I
hope this
think,
doesn't seem like critical. Some it's just patterns that you see over and over again
mhm.
that like I don't get the chance to call the doctor and say, "Hey,
Yeah. But I'm always, like,
maybe."
thankful, and I think it's hard when you've got a busy day and you have patients coming in for just, like, take a look at something, because you still have to write a whole note on it, right? And you gotta, especially when it's
Uh-huh.
something pathology-wise, like, the back end administrative burden that comes with it is so intense, but I do like when my dentists send me things that they are concerned about, because I
Mhm.
think that that's a good way to just have that constant communication and everybody learns from
Oh,
it,
yeah, for
and
sure.
just to have a second set of eyes on it, so I'm never upset about that.
I mean, there's a few dentists that are do it a lot more, but it'll be like, "I saw this on the X-ray, what do you think?" And a lot of times it's like, "Just send them in and I'll take a look and we'll just double check or I'll advise them on it," and I'm totally happy to do that.
Yeah.
Um, I will say, do you get those referring doctors that only call you when there's a problem?
Uh-huh.
At least it's usually a phone call, but, "Hey, doctor, you're the best." They're buttering you up and you're wondering
Yeah.
what's coming, and then, "So, I got this patient," and it's always this emergency that needs to be seen, like, right at that moment, and honestly, I will say, I actually love being the bailout person.
Yeah.
I love a half extracted tooth in the
Yeah,
moment.
same. I do
I
too.
love it.
Too.
This is the best opportunity for me to
Mhm.
show my skills and to save the day.
Mhm.
It's usually never that hard of a tooth to get out, ironically enough. I am so happy to help. I really am. But it's so much happier to help when I have that relationship with you where
Yeah.
we're constantly talking and you're sending me other cases. But there are a few of those people that only call me when I'm vacation.
Mhm.
Like, there's one doctor, every time I'm on vacation, I get a call from him for some
Oh,
reason.
that's
He just
so
got the best
interesting.
timing.
Yeah.
And
And you're like, "I swear I'm not always on vacation." I know
no,
that
well,
it
I
seems that
am.
way, but I swear I'm not.
I try to be as much as possible. But yeah, it's funny how, like, seriously, every time I'm on vacation, he's calling me. I'm in Japan, he's calling me. I'm in Nashville, he's calling me. I'm in Florida, he's calling me. But I'm so happy to help. But when it's only the dump, and then you're asking me to upend my schedule to get your patient in.
Yeah.
And
I
I
had
always want to be
one.
like, well, where's your best friend that you've referred to every day?
Right.
How come he's so amazing for everything else? Where is he?
Yeah. I had one recently that was like that. It was a half extracted tooth, and it was the second one from this dentist in like a week or 2 weeks. And then the same patient, who was a lovely guy, he had, like, I wanna say it was a fractured off number 12 maybe, and I was like, "Okay, I see that you've got this. Is this something that you'd like to get taken care of as well? What's the plan for this? Have you guys talked about it?" And he said, "Oh, yes, my dentist is sending me to this other surgeon for that. He's gonna take it out and do an implant." And I'm like, "Oh, isn't that so nice?" Like, "Well, where is he today?" You know, "Where's that guy today?" And the patient doesn't know, right? But this is in my inner dialogue. And I'm like, "Oh, that's really nice." And, well, if it doesn't work out, I'm happy to take care of that for you, and if you have a great experience here, I'd love for you to let your dentist know that you did have a good experience here so that, maybe in the future, we can just see you for both things and you don't have to go to a whole bunch of different places. And so, I don't know, because I also look at it from the perspective of a patient's coming to a specialist, they know that they're gonna have a consultation fee. So, like, when they just come and take a look when I'm just looking at something, they still have to pay a consultation, and I try to make it worth their while to be there, and so
Right.
if they're coming to a surgeon for surgery and they have another thing that could be operated on, then I feel like it would be in their best interest to just have it all done at the same place as opposed to going to 2 different places. It's kind of
Uh-huh.
like going to the general surgeon and being like, "Well, I've got this hernia and I also, have acute appendicitis," or whatever, "but I am gonna go to this other person for the hernia. I just want you to take care of the appendicitis." And you're like, that seems interesting. Okay. Like, you wouldn't do that, right? I don't know. Okay.
I had a patient recently that was like that, where his dentist called me and is like, he's already driving a couple hours to St. Louis to he's getting a all on 4, but there's some pathology that they want done before they do the all on 4. And I'm like, well, sounds like they should take care of it maybe at the same time as the surgery.
Yeah. Oh,
And
but
he's
it's
like,
not a
no,
s it's not a surgeon doing the
he
surgery.
really wants to, yes, the truth is revealed. He really wants to do it locally. I'm like, "That doesn't make a lot of sense. They already have the imaging." And he's like, "No, he really wants to do it here." And then they finally came and it was like, "Well, yeah, I'm getting my all on 4 next week, but they think it's the same thing we were talking about. They think there's cancer in my jaw." And I'm looking at it, it's just some cyst. It's probably this residual cyst that's been
Yeah.
there for decades. And we can't do this until this cancer is out. And so you're
Yeah.
like, but why wouldn't they just do it? And you're realizing, oh, this is a general dentist doing, but
Mhm.
sometimes you're like, oh, it's funny that I'm good enough to do this
Yeah.
thing, but not good enough to do that.
Mhm. It's very interesting.
We're happy to have you send whoever. I'm not trying to get referrals from people who don't align with me. Everyone gets to have their preference, but
Yeah.
sometimes those things are just a little on the nose.
Yeah. I'll tell you one thing that I think is really interesting about myself with this is that I do not like the traditional referral stuff. Like the marketing stuff, like, "Let me go take donuts to this office. Let me go take this fruit basket," and this sort of thing.
Mhm.
That to me seems icky because I want you to refer to me because we're friends and you like me and you can text me and you know that I'll respond back and that I will care for your patients. And like if and I know you well enough to know that your staff really likes donuts and they really like them from this place. And so I bring them just because I like
Right.
to make people happy, not because I'm trying to butter you up and get you to send me
Yeah.
things. It just seems so icky to me. And so I'm not even looking for referrals at this point, you know what I mean? But I'm meeting dentists and it's like, hey, let's go for a hike and let's go because I just enjoy having those relationships.
Sure.
Whether or not you send to me or not, I don't care. But I really enjoy having those relationships where people feel comfortable. And now I have people all over the country that will text me and be like, "Hey, will you take a look at this x-ray? What do you think?" Or, "Hey, what do you think about this tooth? Do you think that this is this?" Or, "Ooh, I have this pathology. I'm going to send it to the surgeon, but what do you think? And how should I
Yeah.
approach it?" And, all of that stuff. And I love that.
Don't you think the donuts are for the staff to keep you at the top of mind?
It for sure is.
'Cause
Yeah.
as they're at the desk, like, "Well, doctor recommended you get your thirds out. Would you like to go see Doctor Erin or Doctor Sarah?"
Yeah. But
But then they'll
but I
be
think
like,
if you're
but Doctor
sending
Erin sent donuts last week, parentheses, so Doctor Erin
yeah.
seems really nice."
But I think that it's different if I'm coming as Doctor Sarah and I'm bringing this to your staff and I'm
Yeah,
asking if you've had any weird cases or, like,
right,
"Oh, have you gotten a new CBCT? Oh, that's really cool. What time did you get? How did you get it?" Or like, "Why did you decide on that one?" And, that sort of thing as opposed to like sending a staff member over to bring donuts. So you still don't know you've never met this surgeon and they may be nice, the patients seem to be okay, but maybe they're not okay, but then you never come around, so I'm not gonna tell you that that patient had bad things to say about you because I don't really know you, and,
right.
I think just being there and being present and being available is more important, but yes, I do agree. I think that it is definitely for the staff.
Man,
So,
that's why I live where I do. I don't have to take donuts to anyone unless I'm just feeling friendly,
yeah.
which is really nice.
It is really nice. And I think that was the nice thing about the Navy too, was that we were all like in the same place, and there are certain people that were better at doing this or that. And so it would just get sent to the oral surgeon, like, oh, okay, well, so and so really likes to do this. And so they would see those patients. And that was really nice. And I think that that's probably where all this in my brain, I really do feel like the future of dentistry is in the group practices with
Mhm.
all of the specialties like all in one place.
Yeah,
Kind of like the Navy, because it really worked well. I mean, there was plenty of frustrations,
yeah.
but I think that patients so often have their dental home and going somewhere else is stressful. And then the ability because we all have different electronic medical records, and we all have different ways of communicating. Some send letters, some send emails, and all of this stuff. I think that all of that needs to be streamlined to make it so much better for the patients in
Mhm.
terms of I don't need you to send me to redo a whole other medical history form fill out thing every single office that you go to. It's just so frustrating,
Right.
right?
Yeah.
And in medicine, they can just pull up their prescriptions and what they're taking because I don't know how they do that actually. But like we have to rely on them bringing a list, and that means they might bring the list or they might not bring the list.
Mhm.
Or they just bring you a whole big bag full of medicine. You're like, "Well, which ones are you taking?" And they're like, "Oh, I don't know. I take the
The
green one
duffel
in the
bag.
mornings."
I
Yeah.
know, I know.
And so, I think that there's a better way. I don't know. I don't know what it is. Yeah.
Alright, I won't be counting on any donuts from Doctor Sarah anytime
Well,
soon.
yeah, because 'cause they're not good for you.
Avocados.
Yeah, like sugar
That's
bugs. No
better.
thanks.
Yeah.
So, what do you like getting from referrals? Give me an example of a recent thing. Like, what do you like?
Like, what kinda cases or, like,
Or
just
just in general, like, the communication.
like I said, I love when it's very clear what it is, tooth number, whatever, and you X it out. Sometimes they X out one and write the other, and then you're going, "What?"
Mhm.
Or I really love if it's questionable which tooth we're talking about. Like they're missing a bunch of teeth in the quadrant and it's probably 18 tipping into the site of 19, but you called it 17. It's so nice to say the lone standing molar lower right. I'm calling it 31 or something, like that's
Yeah.
so helpful.
Yeah.
And then I would say if you aren't sending me a digital x-ray, please actually print it on photo paper because
Mhm.
these paper printout, like I can't tell anything. I'm trying to assess the
Mm-mm.
position of the nerve and if it meets any of the potential criteria to put it high risk based on pano for nerve damage and stuff. And I'm like, I can't even. It looks like an x-ray in a snowstorm. Like we got the blizzard x-ray.
Yeah.
So clear documentation just explicitly stating, you know, the tooth, if there's
Yeah.
any question, what we're doing, and high quality x-ray.
Yeah. I think if I
And
could ask for oh, sorry, go ahead.
and then explaining to the patient what they want too,
Yeah.
because sometimes the patient is clueless. I hate being the first one to have
Mm.
to say, "Did anyone say anything to you about this?" Like
Mm.
orthodontists specifically. If you're not going to bring the second molars into place before you deband, can you at least plant the seed? And maybe you do and they forget, I get it, but can
Yeah.
you at least plant the seed that, huh, these teeth might be a problem. They're kind of acting like impacted wisdom teeth. So maybe the best thing to do will be to extract them because I'm not going to wait another 2 years to try to pull them into place. But then I'm the first one bringing it up as I'm talking about
Mhm.
wisdom teeth. And it sounds like I'm a used car salesman
Yeah.
and they're wondering why no one has ever told me this before. And it's
Mhm.
really hard to build that trust when it's like, this has been festering for 6 years, Timothy,
Yeah.
No one,
Yeah.
how come I'm
Yeah.
the only one that had to bring it up? I thought I'm like the referral based one, like the only person in dentistry that's not able to do my own diagnoses on teeth.
Yeah. Yeah. I think if I could pick a couple of things, it would be to have the conversation ahead of time about why they're coming to see us. And I'm not saying sell the treatment, but just have that conversation about treatment planning, about what to expect, kind of. And then letting them also know that you're going to send whatever x rays you have, but we may need to get additional x rays because the images may not capture exactly what we are looking for.
Right. That would be so helpful.
I think those would be
Again, used
probably
car
the
salesman. Why do I have to get more
yes,
x-rays? I
I
already paid for
know.
that. Well, did you
Yes,
get the one that goes all the way around your head? I think so, but I don't know. You're
right,
trying to flesh out all this stuff.
right. Yeah, and so I think that those 2 things would and clear communication, just like, "This is the tooth that we're looking at, this is the diagnosis, and here is my plan." Like, we've talked about, restorative, or we haven't talked about restorative. Do you mind talking about that? You know? I'm not sure if they're wanting an implant, but we talked a little bit about it, and so if you could talk
Right.
a little bit more about that, that'd be great. Just that
Right.
little communication piece.
Right. Or they're planning on full dentures or we're doing a partial or they don't want anything. So that stuff's really helpful to know.
Yeah. Yeah, because I only want to set the patient and you up for success. That's all I
Right.
want, and I don't want the patient to be left wondering, well, now I've got this space, but nobody's told me about what to do with it because they're not going to be likely to go in just to ask the question about what to do with it.
Mm-hmm.
And so then it's going to sit for another 6 months to a year for their next cleaning. And then as bone goes away, we may be putting ourselves in a more difficult position to take care of it.
Yeah, well, I
So,
think the dentists don't realize how often we have these conversations, or I assume I'm not the only one, where I'm looking at this practically blank referral and a bad x ray, or I didn't even get an x ray, and I'm trying to put the plan together. And then I start asking questions to the patient, and then the patient gets agitated or
they
upset
do.
or worried
Especially if
when,
they're in pain already, and then it's
why
like,
didn't my dentist tell you this? And they didn't communicate with you and they didn't send that going back to they didn't send the x-ray. Like they get upset and
"Ugh."
they get upset at the dentist also. Like the dentist is supposed to do that. And I can't believe like it's always that. And we're trying to help save face for the dentist. And it's usually not that big a deal on our end. Like, well, we're gonna figure it out and but being a little more open in the communication could save a lot of that because in the moment, maybe it seems like it's not worth it, or maybe your assistant's quickly jotting something down. But
Mhm.
if you can be a little more communicative for us, we can again support you a little more, and the patient doesn't have to have that. My
Yeah.
dentist doesn't know or they dropped the ball, because I feel like I have that conversation a lot. Patients
Yeah,
automatically go to the dentist dropped the ball. Why didn't
right.
they XYZ? And again, to us, it's not that big of a deal, but I don't know if dentists know that we're having these conversations on
Yeah.
the daily. And it's little tweaks that could prevent that.
Right, I've had other dentists that will put the images, like a CBCT or something, onto a thumb drive and give it to the patient, which that's an added expense, right, to be able to do
Mhm.
that, and give it to the patient, and then the patient doesn't bring it with them.
Right.
You know, because they're trying to get to the appointment on time, and they're trying to make sure they got their insurance information, and they tried to fill out the form online, they couldn't fill it out, and then they, of course, forgot the thing, and now they live 20 minutes away, and so it's not
Yeah.
like they can go back and get it, and, there just has to be a better way, and so I don't know what it is. I mean, I have ideas, but I don't know what it is. So,
It's hard
because
because you try to make the patient accountable for their own thing and make sure the denture is there, or the X-ray
right.
is there, and
Yeah.
then
And these
sometimes
days,
that
I
doesn't
feel
work
like
out.
so often if you are, like, as the general dentist, are referring a patient to a surgeon, they have a certain insurance, and you don't know if the surgeon takes their insurance, and so they end up going and finding on their insurance website the surgeon, but that surgeon doesn't, do this, or it's me and I take that insurance, and now I haven't gotten any information from you, and the patient just shows up,
Yeah, the
you know,
self-referral, yeah.
and then I don't know why they're there until they show up because they actually have the referral with them. And then they're mad because I don't have a whole plan made for them. And I'm like,
Yeah.
but I just met you and I just found out what you need and I don't know. And so that's
I
really,
I ran into something like this recently that I thought was really interesting. This patient, like, needed this tooth out or something, and we didn't have a referral, and it's from the root canal doctor, and so we call the endodontist, and they're like, "Hey, can we get the referral? She says she saw you, she doesn't wanna do the root canal anymore, so she wants to have it out," and they're like, "We're not sending you a referral," and you're like, "You're not? Why not? The patient doesn't wanna have the root canal, so she needs an extraction, so can we get the referral?" And they're like, "There's not a referral." And I'm like, "Well, she's, like, in horrible pain. We're just trying to help her. Can you help us know which tooth?" And they'll be like, "Well, the doctor wrote it's number 18 or something." And we're like, "Well, can you send the note over then just saying that he's planning a root canal on 18, even if he's not willing to refer her?" And they're like, "No, we can't send the note." And I'm like, "Can I talk to the doctor, please? He's not
right.
available." And I'm like, "What is the deal?" She was calling the referral the note, and so since there's not a referral, she wouldn't send it. She was confused about what we meant by note, and so I'm meaning, like, the doctor's note. Just send me his documentation. She's like, "There's no note." And I was like, "Clearly he can't have seen the patient without writing a note." And she's like, "There's no note." And I was like, "What do you mean there's no note? How could there be no
Oh,
note?"
God.
And so we were running around in circles. This took us like 2 or 3 appointments to get it figured out, and the patient's having pain, and we're trying to get it sorted, and I'm like, "I'm so confused," and it was all because the staff member was just
Was,
using the wrong word.
my gosh.
Once we said the documentation, she's like, "Oh, yeah, well, I can send that over." Like, oh my gosh. But, you also wonder how many times your front staff are doing things like this that the dentist has no idea.
Yeah. Yeah. And I mean, there's been a lot of turnover in the dental space, right?
Yeah.
It's hard
Oh,
to
yeah.
keep staff. And so every time you get somebody new, you're training them.
And you don't know that you have to be explicit about, like, the note is this and the referral is not, we're not calling that a note, but if we are, even that's okay, but we'll just send what we have.
Right.
We're all
Yeah.
going in circles over a term that was not being used appropriately. That was very bizarre.
Nice.
So one of my big pet peeves, just in general, is the overuse of antibiotics. And I
Mhm.
wish that the dental community knew more about this. The CDC said 1/3 of prescriptions at least are unnecessary, and that's just across all of medicine. And about 10% of dentists of antibiotics are coming from dentists,
Oh,
and
wow.
they've estimated about 80% of those antibiotics are not necessary.
Oh, wow.
So we are way, way, way overprescribing in dentistry, and I wish that dentists knew that and that there are actually risks associated with that. Like I hear all the time, even from non-dentists, like, just we're just gonna give you an antibiotic. What's it gonna hurt? And it can
Right.
hurt.
Oh my gosh, can we
And
talk about gut microbiomes? Woo, this is my favorite topic.
my friend had C. diff, and I thought it was so funny. She was speaking in church the other day, And she was talking about it, and she slapped this paper on the front of the pulpit. And she's like, I know we don't normally do this, but I want you to be able to see it. She was slapped like, C. diff sucks.
Yeah. It's
She
all
was 26-year-old, had an
wow.
ingrown toenail, took some antibiotics, and got C. diff from it.
Oh, that's so sad.
She's like
Oof.
this healthy wellness fitness guru person, like not the poster child for C. diff, right?
Right.
But that's one of those like, oh, you got an ingrown toenail, we're just gonna give you some antibiotics. So she had C. diff for
Mhm.
6 months. Antibiotics weren't
Oh my
working. She finally had to have
gosh.
a fecal transplant before she got better. Like so sick.
Wow.
You can die from that. So
Yeah.
it's really important. And then we're getting all these resistant infections, like
Mhm.
gonorrhea is becoming resistant, and that's usually really easy to treat. But then we're having to use really high level antibiotics on something dumb like gonorrhea.
Mhm.
And then when we need it for something real, then we die because it doesn't work anymore.
Yeah.
So it's so important. So,
Yeah. But in dental school, I know in residency, we had multiple lectures on antibiotic stewardship, right?
hmm
But I never heard of that before I got to residency. In dental school, we never talked about that. It was like amoxicillin, PenVK, go,
right.
or
One of
Augmentin,
our endo
go. That's it.
instructors was like really passionate about root canals don't need antibiotics. And, like, the problem is he was so dogmatic about it that every once in a while I feel like you do have this big abscess, like you do,
Yes.
and so it doesn't make sense to you, but, like, they need to be more explicit.
Yes.
When there's swelling,
Yes.
then that and so there's really only 3 diagnoses in all of dental that require antibiotics, and that's facial cellulitis, lateral perio abscess, and pericornitis. And even pericornitis, I would argue, get the tooth out or maybe some
Yeah.
chlorhexidine.
Right.
So there's really only a very few, but especially when I moved to our small town, it's gotten better, and maybe it's because of my advocacy, I'm sure that's what it is, but it seemed like every single patient was
Mhm.
on a course of amoxicillin before they
Well,
came to see me, and it's
right.
just a
And if they go
just
to the
in
emergency room,
case.
they don't even hardly look at
Oh
them.
my
They just prescribe
gosh.
it.
And
So
so
it's
I'm like, really, what are we treating with our antibiotics? We're treating pain, and pain's a
mhm.
symptom. It's not a diagnosis. We have to actually come up with a diagnosis and realize what we're treating. But I had one patient, he was on an antibiotic until he got in to see me. Wasn't even as a preventive, wasn't even having an infection. He was on it for longer than he was on an antibiotic for his MRSA infection in his leg. So he's on a
Wow.
6-week preventive
Yeah.
course when he didn't even have an infection. But it's like,
Ugh.
well, I'm having pain. I don't really know why or whatever. So here's an antibiotic and it feels better, but you didn't need it. Like, so it's such a frustration to me. I think
It
it's so
is.
important and we don't realize the risks that come,
Mhm.
and it seems easy and it's cheap, but it's not. It's not.
Right.
There's a cost, and there's a
Yeah, so is
cost for the
McDonald's. It's easy and
patient.
cheap, but,
Right.
you know.
Right.
Yeah, I think that it's because I spend and we've talked about this before, I spend an inordinate amount of time talking about if I'm prescribing an antibiotic, and then I talk about, "Okay, well, we need to get some prebiotics and some probiotics on board, and so let's make sure that you're eating your vegetables and leafy greens, and, you gotta do all this to feed your microbiome, and then we've got probiotics to can, kind of reconstitute and get everything kinda back to normal, but, it's important that we take these antibiotics because of this infection, and so but
Right.
these are the steps that we'll take to make sure that your gut microbiome and everything else isn't suffering quite
Yeah.
as much." So,
Well, I even saw a comment on social media the other day where someone said, "Well, one dose of antibiotics not going to hurt anything," and I'm like, "You can get C. diff from one dose, and it could be fatal." So, I mean, I'm not meaning to fearmonger or anything, but
right.
when antibiotics are necessary, thank goodness they found
Mhm.
that mold that cured infections,
Yeah.
that changed the world. And we don't die from dumb things like ear infections anymore, but we don't want to die from dumb things like ear infections in the future because
Yes.
you had some pain or the preventive. You're going to see the oral surgeon when you get in. Here's an antibiotic that you can take just in case until you get there.
Right.
Most of the time, they don't. And people are on it. I always say, so did you have an infection? Like, I don't know. Were you swollen? No.
Or they're like, "I took it for a day or 2, but then I didn't really know, and so I stopped taking it," and you're like, "Ugh." It's almost worse.
I found my grandma's old stash of Bactrim or something.
It's the worst. Yeah.
So we need to do better, dentists.
Yeah.
That's
Yeah.
a big thing. And for joint replacements, just stop. There's no evidence for that. I just got finished with this antibiotic lecture, so I'm really
On
up on
it.
the stats.
Good.
But, like,
Yeah. And
the problem
we'll have to do
is
a whole episode on it because I'd
we
really like to do
should.
that. Yeah.
The American Association of Orthopedic Surgery is kinda waffled on the recommendations, so they're finally,
Mhm.
like, back in line with the ADA, and there's 0 studies that show that dental causes joint infections. 0.
Yeah. I mean, there's
And one even
anecdotal
showed
evidence, right? And so I think that's why the waffling happens.
yeah, so we have those, like, anecdotal studies that
Right.
spook us, but here's some actual evidence. 1, they've never shown that there's a risk. 2, one study even showed a higher risk for people getting antibiotics.
Yeah.
Okay, and that's probably 'cause they're high-risk patients, right? Like,
Yeah.
people who are high risk are the ones that are maybe getting those more. But that, that's not nothing, that's interesting. And the other thing is that the infections that they're culturing are not strep, usually they're usually staph, and that's like
Mhm.
more of a
The
skin thing,
skin.
that's not an oral flora thing, so but we're all afraid we're gonna get sued. I don't wanna get sued.
Yeah.
But if you're following the evidence, then you hire me as your expert witness, and I will come and I will say why you're fine. I mean, I just think you gotta do what's right with the science, and it's funny to go against the science because you're worried about getting sued. That doesn't really make sense either. Or what if you get
That's
sued because
funny.
you get C. diff and they have some major complications and die? And I will say I had a
Yeah.
patient die of C. diff, so it's not like it never happens or I've never seen it.
Mhm.
I had a patient who literally had C. diff and passed away. So
Wow.
it's a real deal.
Yeah.
So stop doing
So
that.
what do you do if the orthopedic surgeon recommends prophylactic antibiotics?
Well, usually I will tell the patient that it's not really supported by the science anymore, and if they and their surgeon feel like it's appropriate and needed, then the surgeon can prescribe it, but I'm
Okay.
not going to do that for them.
Okay.
A lot of times the patient will be like, "Yeah, that makes sense," and we'll go ahead with that. Or again, they call their doctor, but I don't remember the last time I did it. I don't
Mhm.
think I've made a prescription for that in 10 years.
Yeah. Yeah.
I haven't been sued yet for that, thank goodness. Knock on wood. Take that back.
Yeah. Yeah. Careful with what you wish for.
I know, I know.
Cool. Well, we love your referrals and we love to see your patients. And most importantly, we love to see you and chat with you and communicate with you
Yes.
and have conversations and discussions. And you guys teach us a lot of things. And that was one of the things at the Doctors All In retreat that I really enjoyed was that we had a couple of general dentists, pediatric dentists, periodontists, and I loved being able to ask them questions and I love their insight and their perspective on so many things. And I think that those are the things that we miss out on when we're not, in active communication with
Yeah.
the dentists around us and with referrals. And so I think that's super important. And so we love that and we want more of that. We want more of you, even though none of us have any time. But I think we can make time for those sorts of things because it makes everything so much better. It makes the patients, care so much better. It makes our day so much better. And it makes your day better too, because you know that you have a friend to call if you
Yes.
just need anything. So I think that that's really wonderful.
Yes, I love having that relationship where you can call me like, "This patient is having such a hard time getting in, and your staff says they can't get in for 6 months." Like, "Girl, I got you. I'll
Hmm.
find a spot," you know? Or,
Yeah.
"No, I don't think this lesion is anything to worry about. You can tell the patient this and check on him in 6 months," or, "Ugh, why don't you just send him? We'll take a look." I love having that personal relationship, and it's so much easier to take care of your patients and, again, have your back when we have that relationship and we really know you as opposed to, like, I don't know who Doctor Smith is because I didn't even know there was a Doctor Smith, and so do you think that the tooth really should come out when they didn't say why? Like, yeah, I think hopefully Doctor Smith's a good doctor.
Yeah.
So we're just really here to support. And again, hopefully it didn't sound like criticism. It's more just patterns we see and hopefully we can all communicate and do better so we can
Yes.
take better care of our joint patients.
Right. And please, please go on into Instagram and follow us, the Resting Stitch Face podcast on Instagram and comment on this post because we want to know what we can do better also. I'd love to
Yes.
hear what things the surgeons are doing that drive you insane because that's the only way that we can make it better.
Yes, that's so true. I mean, we need to get a couple dentists on to tell us what they want us to do. Because I remember being on Facebook, some Facebook group, and they were like, "Can you believe this surgeon did this thing without asking me or something? How terrible!" Like they placed an immediate implant or something. How dare they? And I was so surprised. There was like hundreds of comments and they're like, dropping that surgeon. And the surgeon is supposed to do what I want them to do. And they can't just do stuff like that. And maybe we have the relationship with my referring doctors where if they send me a patient to take out the tooth and the patient wants an implant, and we can do it immediate. My referring doctors seem to appreciate my judgment and understand that, and so we're gonna do what the patient wants and what's best for the patient, and I guess that's our relationship, so I was just
Yeah.
blown away.
Yeah.
Like, "What? People are mad about that?"
Yeah.
I had n that was not on my radar. I had no idea.
Right.
I'm pretty naive. I had no idea that they would get mad about
Yeah.
that, so I
And
know
that
there
was
are
the thing in
things
the
that
military too, is
we're
that like,
doing.
yeah, I think I have, if there's something that's not on the referral, I will always try and call, but everybody's busy again, right? So it's like I can
Yeah,
call, but I may not be able to get them, but like, hey, I'm calling because this patient is in the chair and I they're asking about an immediate implant. If I'm able to do it, is that something that is okay with you? And then they can pop over and ask the dentist. And usually that's all that you need, but it's just,
right.
yeah, that's scary.
Yeah, I mean, sometimes we make those judgment calls like, "We got this abscess root tip. I'm just gonna get it out while we're there." And then like, "Oh my gosh, you're mad about that?" Some of those things are just not on my radar. So it would be very helpful to hear your point of view. So
Yes.
if anyone wants to come on and discuss, let us know and we'll get you scheduled.
Yeah.
Thanks again for hanging out with us on another episode of the Resting Stitch Face podcast.
If all of this resonated with you, or if you found these conversations interesting, or a friend that would find them interesting, please like, share, follow along, and we'd love to have more conversations with you soon.
Catch you next time.